This is quite a directive to ambulances, Aaron, in Los Angeles County, that they don't have the space to even try on people who are likely not going to make it.
Yeah, that's right, Katie. This is a desperate situation. You can see outside this hospital in Burbank, triage tents have been set up. Joining me now to talk about this situation is Dr. Angelique Campen. Dr. Campen, if you can just explain what this means, this edict that has gone out to ambulance crews not to bring patients to your hospital, the sickest patients, the ones that are very likely to die. What does that mean for you?
Well, I think this is the first that you're going to see of having to make the tough choices of rationing care and not putting our very strained resources towards patients that have very little chance of survival. It's already been a protocol that not to move a patient until we've established that they've had return of circulation. We've been able to make exceptions to that rule, though, when they contact us over the radio. But now paramedics have the authority to stop all efforts on their own.
So what exceptions are you talking about that will no longer be made?
So if someone does not get return of circulation, their chance of survival is 0.1%. To transport that person to the hospital will require all hands on deck, lots of resources put to them, at the peril of the others that we're trying to take care of in the emergency department. So this is the hard decision that we just can't. We don't have the resources to do that. So those patients are not coming to the emergency department at all.
And the ambulances are also rationing oxygen. There's also potential for crisis standard of care to be declared at hospitals throughout Southern California as well. That hasn't happened here at this hospital. Why?
That hasn't happened yet. We are up against the wall. We are really operating at our absolute maximum capacity. We have not yet, I do not feel that we have yet not been able to care for a patient. But my fear is any increased volume is definitely going to put us over the edge. So this is the time to act now and prepare for what's to come before it happens.
Dr. Campen, thank you. Katie, back to you.
Dr. Jha, I'm struck by that doctor there, and I'm struck by this whole situation that we're in. We are the wealthiest nation in the world. We are the most advanced nation in the world. We are a nation that people come to seek the best health care in the world. And we're now in a situation where we're rationing care, where there's worries about supplies of oxygen, and we're a nation that can't get the vaccine out, even though we have a stockpile of it.
Yeah, so Katie, thanks for having me on. It's a reminder that even a healthcare system as sophisticated as ours can't compensate for a completely disastrous public health response. And that's what we have in our country, a public health response that has failed at almost every turn in this pandemic. And you can call me naive. I really thought we were going to get the vaccine part right. There was so much attention to the vaccine with Operation Warp Speed that I thought, well, even if we mess up on testing and protective equipment and on misinformation, that surely we're going to get vaccines right. And it really appears like I was being way too optimistic. Now, we have great vaccines from a science point of view, but our ability to get those vaccines out and into people's arms has really been quite mediocre and disappointing.
It's deeply frustrating, and it's angering for a lot of folks. There's also this new strain that's now been detected in a fourth state. It's been detected here in New York. When you look at what's going on in the UK because of the prevalence of that new strain, how it's taken over there, they're in another national lockdown. Should we be worried about the same thing happening to us?
Yeah, so this strain has been found in Colorado, in New York, in Florida, and California, in people who have not traveled, meaning they all got it from community spread. It stands to reason that the virus is circulating in places between these four states, i.e. probably in large parts of the country. The best estimates are that about 1% of all infections right now from this strain, but the best model suggests that a majority of infections by March will be from this strain. I am very worried about how much strain it's going to put on hospitals. We heard from that last report that LA can't handle more. If this strain really takes off in LA, they will need to handle more. And that's going to be very, very harmful, not just for people who get COVID, but for everybody else who needs health care. So we're in a difficult situation. It's one of the reasons why I and others have been pushing to get vaccines out much, much more quickly. We need to start building up immunity in the population. We're in for a very difficult 4 to 6 weeks ahead.
What about the other strain that's been detected in South Africa?
Yeah, we're still learning about that. I haven't seen any evidence that that has been detected here yet. There is, again, some preliminary evidence that that strain may be a little bit more resistant to some of our therapies, the monoclonal antibodies. We don't know what that strain is going to do to our from an efficacy of vaccine point of view. So there's a lot to sort out here. This is essentially what happens when pandemics sort of run wild. You get lots of mutations, and you start getting strains that can become resistant to things. One of the reasons we want to keep the level of infection low is we're going to give the virus fewer chances to mutate. We haven't done that. And the whole strategy of kind of let it rip, let lots of people get infected, harmful in lots of ways. One of them is we're essentially giving the virus more chances to mutate.
Dr. Ashish Jha, thanks for joining us. Erin McLaughlin, thank you for joining us as well.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.